Question 11. After their 6-month-old son is diagnosed with hemophilia A, the parents decide to go for genetic testing and counseling. The test results show that the mother is a carrier and the father is unaffected. What is the likelihood of their having another child affected with this genetic disorder? B. 25% chance that a female child will be a carrier of hemophilia A. Hemophilia A, also called Factor VIII, FVIII, deficiency or classic hemophilia, is a genetic disorder caused by missing or defective Factor VIII, a clotting protein. Hemophilia is inherited in an X-linked recessive manner. A daughter who inherits an X chromosome that contains the gene for hemophilia is called a carrier. She can pass the gene on to her children. Hemophilia can occur in daughters but only rarely. For a female carrier, there are 4 possible outcomes for each pregnancy. 1. A girl who is not a carrier. 2. A girl who is a carrier. 3. A boy without hemophilia A. 4. A boy with hemophilia A. Question 12. EMS transports a young client who sustained a gunshot wound to the head in a drive-by shooting. On arrival to the emergency department, which assessment should the nurse do first? B. Airway. Assessment of a head injury can follow the A to E algorithm. A equals airway, B equals breathing, C equals circulation, D equals disability neuro, using the Glasgow Coma Scale, E equals exposure, lacerations, facial fractures, depressed skull fractures, basal skull fractures, Battle's sign, clear discharge from nose or ear, or obvious penetrating injury. With any head injury, always consider the cervical spine. It may require immobilization before starting the assessment. Question 13. A newborn is diagnosed with tracheoesophageal fistula, TEF, shortly after birth. Which finding will be most important for the nurse to report to the healthcare provider, HCP? A. Cyanosis when feeding. The nurse should report any cyanotic episode to the HCP. A priority for TEF is to maintain an open airway and prevent aspiration. TEF is an abnormal connection between and NBSB, the esophagus and the trachea. As a result, swallowed liquids or food can be aspirated into the infant's lungs. Direct feeding into the stomach can also lead to reflux and aspiration of stomach acid and food. The other options are normal findings for a neonate. The normal respiratory rate range for a newborn is 40 to 60 breaths per minute. Tachycardia when crying is normal, at the top of the range of 107 to 181 bpm. Initial meconium is black, tarry, and sticky. Question 14. The high school nurse is teaching a sophomore health class about sexually transmitted infections, STIs. Which of the following is the most common STI in the United States? C. Human papillomavirus. Human papillomavirus, HPV, may not show any symptoms until it causes genital warts, a bump or group of bumps in the genital area. About 80% of sexually active people will contract this STI at some point in their life. Cancers from HPV may not be evident until they are discovered through routine screening. Chlamydia is the most common reportable, or notifiable, STI in the United States. Both men and women can get chlamydia. While the disease is easily cured, it can severely and permanently damage a woman's reproductive system, making it difficult or impossible for her to become pregnant. Chlamydia infections often have no noticeable symptoms, so persons infected with chlamydia may be unaware that they are spreading the disease to others. Anyone who has unprotected sex can contract chlamydia, although statistics show that sexually active young people, particularly women, are at higher risk. Gonorrhea is the second most reportable STI, followed by syphilis. Question 15. The school nurse has been invited to participate in a workshop for parents on childhood nutrition. The nurse knows that the primary nutritional disorder for school-age children is C. Childhood obesity. School-age children, ages 6 to 12, have a consistent but slow rate of growth and usually eat 4 to 5 times a day, including snacks. The Centers for Disease Control, CDC, reports an 18.4% obesity rate for this age group. Factors that contribute to childhood obesity are often lifestyle-related, too many calories and too little physical activity. Other factors include family history and habits, psychological reasons, such as stress, boredom, and emotions, socioeconomic issues, such as limited resources or access to fresh foods, and lack of knowledge about nutrition. Obesity in childhood can lead to adult health problems, diabetes, high blood pressure, and high cholesterol. Many obese children become obese adults, especially if one or both parents are obese. Childhood obesity can also lead to poor self-esteem and depression. Eating disorders, anorexia and bulimia, tend to occur in adolescence. Picky eating often begins in earlier than school age. Question 16. The pediatrician prescribes amoxicillin suspension 200 mg POQ 8 hours for a 3-year-old client with acute otitis media. The child weighs 38 pounds, 17.2 kilograms. The recommended daily dose range for children up to 40 kilograms is 20 to 40 mg/kg day in divided doses every 8 hours. Following the 10 rights of medication administration, what is the nurse's best action? A. Administer the medication as prescribed. The nurse should administer the dose, since it is within appropriate guidelines. The child may safely receive 344 to 688 mg day, in divided doses of 115 to 230 mg each. Amoxicillin, 20-40 kg day, is the antibiotic of choice for treating acute otitis media in clients older than 2 years who are not allergic to penicillin. Approximately 80% of children will have at least one episode of acute otitis media. The 10 rights of medication administration that are applicable here: right patient, right medication, right dose, right route, right time, and right assessment. Question 17. After a high school athlete sustains a fractured femur during a competition, a full leg plaster cast is applied. When the nurse provides discharge instructions to the athlete and their parents 6 hours later, which statement by the athlete indicates a need for further education? B. I should walk around on my cast as soon as I get home. Plaster casts are made up of a bandage and a hard covering, usually plaster of Paris. Client instructions include: 1. Keep the limb raised on a soft surface, such as a pillow, for as long as possible in the first few days. This will help any swelling to go down. 2. Keep the cast dry. If the plaster gets wet, it weakens and is unable to support the bone. 3. Do not put anything into the cast to relieve itching. This can damage the skin and cause an infection. A hairdryer set on cool or an ice pack over the itchy area can help. 4. Immediately report any pain, tingling, or numbness, or if the toes turn blue or white. Question 18. First-time parents bring their 2-week-old infant to the pediatric clinic because they're worried about their baby. Which of their concerns is the nurse's priority? D. The baby's spit-up seems large and forceful. Pyloric stenosis is a birth defect characterized by forceful, projectile vomiting. It occurs when the pylorus muscles thicken and become abnormally large, blocking food from reaching the small intestine. Pyloric stenosis is 4 times more common in boys than girls. Besides projectile vomiting, other indications of pyloric stenosis are weight loss, dehydration, being very hungry despite vomiting, lack of energy, and fewer bowel movements or frequent stools that contain mucus. The treatment for pyloric stenosis is surgery, pyloromyotomy. The other answer options are not uncommon for a 2-week-old infant. Question 19. When an outbreak of fifth disease occurs at an elementary school, the principal asks the school nurse to give a presentation to teachers and staff on how to prevent spreading the disease. Which of the following should the nurse include in the presentation? D. Teach and enforce proper hand hygiene. Fifth disease and NBSB is caused by a virus called parvovirus B19. The virus is spread by droplets in the air of saliva, sputum, or nasal mucus when an infected person coughs or sneezes. Most and NBSB, children with and NBSB, fifth disease and NBSB, catch it at school or daycare. Fifth disease, also called erythema infectiosum, got its name because it was fifth in a list of historical classifications of common skin rash illnesses in children. Incubation lasts about 7 to 10 days, up to 14 days. The spread of the virus can be prevented by following good hand hygiene and teaching children to cough or sneeze into tissues or their elbow, then washing hands. Food, school supplies, and common objects should not be shared. The child develops the characteristic slapped cheek rash. When the rash appears, the child is no longer contagious. Children should play outdoors as much as possible. It's easier for the virus to spread indoors, where people are likely to be in closer contact. Preventing the spread of the virus is difficult because people are contagious before the rash appears. The symptoms are like a mild cold, runny nose, headache, and low fever. Koplik spots are characteristic of measles. Question 20. The pediatric nurse is performing a respiratory assessment a 2-week-old infant. Which finding should the nurse immediately report? D. Nasal flaring. Nasal flaring and NBSB is a compensatory symptom that increases upper airway diameter and reduces resistance and work of breathing. It is a sign of respiratory distress. Other signs are retractions, use of accessory muscles in the neck, rib cage, sternum or abdomen, expiratory grunting, and wheezing. Normal respiratory rate for an infant is 40 to 60 breaths per minute. Newborns often have irregular breathing patterns that concern new parents. They can breathe fast, take long pauses between breaths, and make unusual noises.